Good afternoon, everyone. My name is Robert Hall. I'm the chairman of Project Elect. We know that Project Elect stands for Enthusiastic Leaders Engaging in Changing Times. We have over the past several months been trying to live our vision of being a conduit for the community in different areas. And we've done several takes on COVID-19 and the virus. And so tonight, we were just trying to continue to push this and push it and push it. But I'm delighted tonight to also have with us live on Facebook, Dr. Rayford. Glad to have you. He's with us again. We usually call him one of the hardest working men in the hospital, but he's hardest working in the community right now, and he's been keeping us just abreast on COVID-19, even before the vaccines and so on. But we're also just happy tonight to be at the Mayfield complex, and we have, I believe, a legend among us. He's not only a leader in our community, our state, we believe nation, but Attorney Kenneth Mayfield. Sir, it's just proud to be here with you, to have you on the Project Elect Facebook Live. And I will say these things. You're the owner, CEO, Mayfield Law Firm, civil rights activist, civil rights attorney. You have written 2 books, To Be Born Black in Mississippi, and The Civil Rights Lawyer, married to the beautiful Mrs. Lois Mayfield. 2 wonderful kids, one that's also a lawyer, one that's in the entertainment field. And I could go on and on and on. But tonight, we also know that we are facing a crisis with the COVID-19 pandemic, especially in the rural areas, state of Mississippi. And we wanted to talk to you tonight as a leader in the community, the things you have seen over the years. And so with 2 of these guys here, I'm just going to go kind of back and forth. And Dr. Rayford, I know you're a pro at this. So bring us up to date, on the numbers of COVID-19.
Yeah, so it's great to be back. Great to share a stage with Attorney Mayfield. Looking forward to a robust conversation. You're right, Robert, we are still in a crisis. So although that there's been some loosening of restrictions, we're still in the middle of a crisis. Although we're not at as high levels as we were a few months ago, we're still very much into a crisis. We've passed the 1-year mark for COVID in the United States. We've learned a lot through kind of science and also through seeing what happens when certain decisions were made. And so the numbers have come down. So the numbers have come down. The number of cases reported have come down. Number of hospitalizations have come down. The number of deaths have come down, but they're still at a high level. If you ask people in public health, the numbers are still pretty high. We're plateauing at some very high numbers. Although, at our peak, we were seeing 4 times as many, cases, hospitalizations, and unfortunately deaths. It's still a significant risk now that we have the new coronavirus variants that are in the United States, and in particular, one that's been described in the United Kingdom is in Mississippi. So we know that a more infectious variety of coronavirus is in the state of Mississippi. So it's time to catch our breaths because the numbers are down, but still recommit to those changes. So those changes that we know do the best that they can to keep us all safe from coronavirus, and if we get it, to reduce our chances of dying or being in a hospital. And we know what those things are. We just have vaccines to add to those. So wearing a mask when you're not able to maintain a social distance, trying to keep groups small, opting for well-ventilated spaces outside is better than inside, keeping groups small, washing your hands. I don't think I mentioned, but I can't mention enough, wearing a mask is really important. And we've actually seen, so in this year's time, we've seen people do it really, really well.
Okay. And I want to go to Attorney Mayfield right after this, but what about the vaccine rates? And we know that there's been some going back and forth on whether African Americans are really getting the vaccine rate as the same as others? Kind of bring us up to date on that.
Yeah, so we're giving more vaccines around the country. We have given almost 80 million vaccines in the United States to date. Maybe 20, 30 million people are fully vaccinated, and so far those are the people that have received 2 doses of the Pfizer and Moderna. We have a third vaccine that's been authorized, the Johnson & Johnson vaccine, and I hope we'll talk about that a little bit more. In Mississippi, we've given out over 650,000 vaccines. Almost 250,000 people are fully vaccinated. We've received just under 1 million doses of vaccine. And so there's more vaccine supply coming. The Johnson & Johnson is going to be added to our supply. In terms of in the African American community, there's a talk where we sat and we saw the numbers. We're looking 15, 16%. That number has actually increased to 24 to 25%. So, as you know, a little bit about that number, we still have a ways to go. I would love for the vaccination rates in the African American community to reflect the African American percentage in the population. So that's 38 or north percentage. And I think we have a chance to do it. We've seen that number rise. We still have work to do in terms of improving vaccine trust, improving vaccine access. But that number is improving. So we're seeing some results of our efforts. If you look at other states that report race, Mississippi is actually on the top of that list.
Interesting.
So Mississippi, District of Columbia, and Louisiana have the highest percentage of African Americans getting vaccines as according to a population. So it's not all doom and gloom.
That's very interesting for you saying that. So, Attorney Mayfield, I know you may be 1 or 2 years older than me and Dr. Rayford. So, what are yeah? So, have you had your vaccine?
I have.
Okay.
Yes, I had mine about 6 weeks ago. As a matter of fact, as soon as they opened it up to the 65 group.
that tells me right. I didn't say
yeah. So I'm not 70.
Okay. All right.
But when they opened it up to the 65 group, I signed up immediately for it. And there is just a lot of hesitation. I tell you, when I went there, I did not see a single black. It was up at the mall. And I had my wife to take me up there because I was a little concerned about the anaphylactic reaction because of a reaction that I had many years ago when I was a teenager. So I had my wife to take me up there, and I even bought the little package. What do you call it? An anaphylactic?
Anaphylactic package.
Yeah. That EpiPen deal.
Yeah.
I went and bought me an EpiPen deal.
Get the whole deal.
Yeah, I was ready for it, man. And but anyway, they were prepared out there for it. We actually, when we got out there, they were prepared in case you had it. They had us to sit out there and wait. Had me to wait 30 minutes since I told them I was concerned about possible reaction. But nothing happened. I mean, they put the little thing in me, and I said, "Are you finished already?" I mean, it was just that quick. My son, on the other hand, who's 32, does not want to take the shot. He's listened to all of these Facebook rumors, and man, he got up that morning. He was visiting from California, visiting the day I took the shot, and I came downstairs. He met me, and he said, "Dad, can we pray?" Yeah, I mean, just that concern about it, you know. And he's a prayer warrior, but we prayed, and I said, "Son, it's going to be okay." And he said, "I just wish you'd reconsider." And he did not want me to take the shot.
Interesting question on that, Attorney Mayfield. I would think that would be just the opposite. With what you've come through and the race relations and some of the myths and things of that nature, I would think it would be different. You would be the hesitant one, and your son, who's 32, would be the one that said, "Hey, let's go get this over." Why do you think that?
Facebook is not our friend when it comes to that.
Oh.
Yeah, that's that social media. Social media has been an enemy of this vaccine, and I know among my son and his group and followers, because I read some of the Facebook posts that he had sent me. Honestly, I would not even read them before I went to take my shot. He kept sending me these posts. I said, "Son, I'm not going to be discouraged, okay? I'm going to take the shot." And one reason I decided to take the shot is I read somewhere where 1 out of 1% of folks who get hospitalized with the COVID would end up dying. It was a high percentage. I said, wait a minute, hold on here.
Wow.
And it said, what are the odds that I would die if I take the vaccine?
Mm-hmm.
And it's, if you were the most unlucky person in the world, you might die from it. That's not even established. They said that there were a few people who took it, and I think it was 6 people I read on the internet. It was something like 6 people in the trial run who took the vaccine, and out of the 6 people, 4 people died. But the 6 died. Excuse me. 4 of the people who died didn't even take the vaccine. They took the, what do you call that?
Placebo.
The placebo.
Wow, that's
That's the salt pill.
Yeah.
4 of them now out of
Wow.
the 6. And the other 6 is not established at all that it was caused by the virus. In fact, nobody believes, in the medical field, believes that it was. But yet this type rumor got spread around, and man, before you knew anything, everybody that was taking the shot was dying, you know.
Mm-hmm.
So it just really frightened people a lot. I'll tell you something else. This was kind of interesting because my mother is 90 years old. And after I took my shot, I called my mother to tell her, and she's in good health. I called my mom and I said, listen, I took my shot. I said, you want me to sign you up? Well, I'm not trying to be the first one on the list, she said. You understand? And but after I took my shot, everything worked out. And then she told me about a week later, she said, I'm ready. So she's now signed up too.
So, and that's a very interesting question. So what you just said is, this is so important to you that you really encourage your 90, and
Oh, yes,
we know
yes,
Mom's
yes,
a heart.
Oh, yes, yes.
And so for you to be, at that level of surety that you encourage her to take this vaccine, that says a
no
lot.
question. I wanted her desperately to take it because my mother is still very sociable, and some of her neighbors won't even allow people in the house. As a matter of fact, my sister lives next door to my mom, and my sister will not let people come into her home except her daughter and grandkids. But my mother was still, if you go knock on the door, my mother will still open the door for you.
Wow.
Okay, so I knew she needed, my mom needed needed to get the shot.
Interesting. So coming back to you, Dr. Rayford, now the basics of how do we sign up, because we know that a lot of people are still in the rural areas. They don't like an iPhone, don't like a computer. What do you recommend on the process again?
Yeah. So first off, I want to piggyback on something you said, Attorney Mayfield, about the power of example, the difference in hesitancy around age groups that is more of a opposite, that people who've experienced kind of worse, the worseness of the civil rights and just coming through. The hesitancy doesn't seem to be from those groups, and how social media can be a place where those voices are amplified louder than they actually are. So if you look at different groups, black, white, Hispanic, there's a fixed group of people who are absolutely against the vaccine, and that number is pretty similar between the groups. There's a huge 85-90% of folks who are either willing or on the fence. But you got 85-90% of the people who are willing under some conditions or already, enthused about it. That vocal minority, that 10 to 15% in certain groups, they are significantly more active on social media. So social media is actually where, so I encourage people, if you're getting it, get out there and engage, otherwise, because I've found, as I'm talking to patients, I'm talking into the community, that there are people who are, I just want to get more information. There's people who, I don't necessarily want to be the first, but if I see people who've getting it, I'm fine. I'll only get it if you recommend it. Hey doc, you know me. I'll only get it if you recommend it. So that power of example, the power of the message, that's what we're doing. I think that's what's driving the numbers. That's what's driving the numbers in the community for a grandson to see their father and grandmama get the vaccine. Your son is much more likely to get the vaccine.
Yes.
He's probably going to take his own time, but he's much more likely to get it through that powerful example. And I think that's a message that may not be highlighted. And one of the concerns with access is I don't want groups to pass over the African American community because there's this perceived lack of trust in the vaccine.
Perception.
I'm not going to fight hard to get you the vaccine because the majority of y'all don't want it anyway.
Mm-hmm.
And I found that to be patently false, that there is interest, there's reservations like in every group, but there's a lot more interest. And so, like I've said before, it matters on who's offering the vaccine. If you're a patient of mine and we're having this conversation and I'm saying, Robert, the vaccine would be beneficial for you. You have some health conditions, and I don't know your history, Robert.
Mm-hmm.
You have some conditions that will make you at risk of dying from coronavirus. This vaccine is safe, and it's going to help protect you. Might not stop you from getting coronavirus 100%, but they do really good at keeping you out of the hospital with coronavirus and keeping you from dying from coronavirus.
Interesting.
And so I offer you this shot.
Mm-hmm.
That's a different offering than a survey. Hey, I'm calling with Pew. I'm calling from Kaiser Family Health Foundation. Would you take the vaccine? It depends on who's offering it.
Mm-hmm.
And so if we can really talk about who's offering it, if it's a son to his mother, Mom, I love you.
Mm-hmm.
You need to be vaccinated. It's a different offer. And I think what we need to do is encourage those conversations within the community, because they're already going on, and there's more willingness for the vaccine. It's just all in how it's offered. And so an ideal is we can get to that point where, it's going to be easy. And so we get to your access question. It'll be easy to get the vaccine after that conversation. So you are kind of wearing down barriers and obstacles. Attorney Mayfield had that conversation with his mom, and she says yes. It doesn't need to be 3 weeks before she gets the shot in her arm, because that's 3 weeks of exposure to everybody else. Grandma, I'm worried about you. I'm worried about this vaccine. Grandma, people from any and everywhere, I heard you getting the vaccine. I'm worried about it.
Mm-hmm.
So, that time, and it's not, we're not trying to sneak it in or anything. It's a good thing. There's no funny business around it. But one thing that, that's before us all, particularly in healthcare and community, is to just make sure that we can match access to the trust is already there. We can work hard to improve the trust is not there. And then if that trust go up, make sure access is always able to match the trust. Because if I can't talk somebody into something and I'm not able to offer it, hey, Robert, you need a vaccine. Yeah, I want it, Doc. I'm not sure how you're going to get it. Maybe 4 weeks before you can get it.
So two-part question right there, Doc. And one question for you, but then you chime in and I'll push in between. So there's 3 different vaccines out there.
Mm-hmm.
Attorney Mayfield, which one did you actually
I did
take?
the Pfizer.
You did Pfizer.
Actually, I signed up for Moderna. When I got there, they said they were out of Moderna, so Pfizer. I took the Pfizer.
Okay. So now Johnson & Johnson is there.
Yep.
And of course, we know the other one is there. So we talk about access, but the thing is that we got 3 different companies making 3 different vaccines. My thing is why didn't Johnson & Johnson just go over to Pfizer and get some of theirs and say we're going to help get it out? So what is the difference? Because that's a question that I think.
Yeah. That's a very important point, because Johnson & Johnson is different from Pfizer and Moderna. So Pfizer and Moderna, real quick, uses a technology that's not new. It's the messenger RNA technology, where you take a recipe, you inject it in the body makes a protein, and protein's recognized by the immune system. And the the Pfizer and the Moderna vaccines, you put that recipe in a little drop of fat. And that's what it is. A little recipe and a drop of fat, you inject it. It does what it needs to do, get your immune system trained so that when it sees coronavirus, it can already have a preformed protection. So instead of a fat droplet, Johnson & Johnson took a recipe. It's a little different flavor recipe. And it instead put it in a harmless virus. So instead of a fat droplet, they took a virus that's harmless and put the recipe in the virus. And then they injected the vaccine. When you inject the vaccine, the recipe tells the cell to make the protein, and it creates, so it's a similar message, not the exact kind, it's just the delivery is different. And with that, because the delivery is different, there's differences in terms of storage.
Mm-hmm.
And Johnson & Johnson decided, so there were many companies over a year ago testing out the possibility of a vaccine, different approaches. So Johnson & Johnson decided to try this approach, going through the inactivated virus approach, deliver the message through a virus that's harmless. And what happened was you ended up with, companies competing, and that actually meant that there were more products available. Johnson & Johnson decided to study one dose, a single dose vaccine. That's what they decided to study because it has some upsides. So that, with a Johnson & Johnson vaccine, you drive up to the mall, you get your first shot, you all set. There's no looking for you again. There's no calling you, trying to encourage you to get the second dose. That's what it works a little different. So delivery is a little different. The actual protein that it trains your body to make is similar between the vaccines. So the approach of it's just delivering the recipe is different.
Okay.
So Johnson & Johnson is one shot. The other two are both 2 shots. Pfizer is 2 shots separated by 3 weeks. Moderna is 2 shots separated by 4 weeks.
Okay.
Johnson & Johnson was later into the field. And so Johnson & Johnson studies happened later than Pfizer and Moderna. And it's really important to note that Johnson & Johnson studies were done at a time and in places that actually had the new coronavirus variants that we're talking about right now.
That was my next. You just said
So we had those new coronavirus variants in the places and in the time when the Johnson & Johnson vaccine was studied. And so you see a number, if you just look at the number, the effectiveness, some people call it the top number. Johnson & Johnson's effectiveness is 70% in the U.S. And when you look at all the different places, South Africa and other places, it goes down into 60% in terms of preventing moderate coronavirus. Compare that, and you really can't compare it to, really close. You kind of have to loosely base it. You can't compare Johnson & Johnson's 70% to Pfizer's 95% and Moderna's 94% because time and place were a little different and the studies were designed a little different. And so it's not true that Johnson & Johnson is a worse vaccine than Pfizer and Moderna. So that's important to get that message out that if you need a vaccine and your options are available and you have Johnson & Johnson, that's a good vaccine.
Go for it.
That's a good vaccine. Right now, we still want you to get the vaccine in your body that you can get. And then I'll quit talking after I say this. And the reason being is, in healthcare, we ask for vaccines to do 3 things. And I'll start with the most important one. We want vaccines to decrease the amount of people that die from whatever the infection is. That's most important. So if we get a number 1, we will still push a vaccine, even if it don't prevent 2 and 3. 2, we want a vaccine to reduce the risk of being in a hospital and having complications from whatever virus.
Okay.
That's so important that we will accept the vaccine even if it doesn't do number 3. That's good. And number 3, we ultimately want a vaccine to cut down the number of infections from the virus. Less people dying, less people sick and in the hospital, less virus. All of the vaccines do 1 and 2 almost equally well. And that's kind of the number you're not hearing. That if you look in the studies, there was 0 people in the vaccine group for Johnson & Johnson that died. 0. And reducing the rate of hospitalization was pretty significant. So all of the vaccines are 85% or more effective at preventing hospitalizations and severe coronavirus is what leads to coronavirus deaths. So we got those things, and that's why Johnson & Johnson is a good option. And so you're not getting second-rate vaccines if you're offered if you're offered Johnson & Johnson. It's not. There's no rope-a-dope. There's 3 things we want a vaccine to do, and we know that flu shots do 1 and 2 perfect. And that's why we promote flu shots every year. If you look at the effectiveness of the 2019 flu shot, Johnson & Johnson, Pfizer, and Moderna blows it out the water in terms of effectiveness for the disease that it print. Blows it out the water. Like, in terms of the number, 2019's flu shot effectiveness was maybe right at 50% in terms of reducing the flu, activity against the strain. So it's really important. It's a little long explanation to know that you're not getting an inferior vaccine if you get Pfizer and Moderna. And in fact, you might actually get more people to say, hey, give me one shot. Give me one shot. And the last thing I'll say about Johnson & Johnson is when you look at the side effects, the percentage of people having side effects with Johnson & Johnson is smaller than the percentage of people having side effects with Pfizer and Moderna. And so that's also something that may appeal to people, that still similar, sore arm, muscle aches, small group of people get fever, tiredness, but the percentages for Johnson & Johnson are lower than what's been reported for Pfizer and Moderna.
That is interesting. And for those of you that may be just joining us or watch this later, this is Project Elect. We're putting information out through the community about the vaccine, of course, and also about COVID-19. We're here with Dr. Rayford, IMA of Tupelo, and attorney Kenneth Mayfield. And Mr. Mayfield, I'm going to tweak just a little bit because I think this is important. Now, we know that there were studies done years and years ago where a lot of us get in our head that the black man was used as a guinea pig. You've fought a lot of things on civil rights. Been kicked out of 2 universities, that's in your book. So, with that mindset now that, hey, and I'll just have to come out and say it, that the white man is making this vaccine to harm the black people. What does that myth mean to you, knowing the real civil rights push and what we're trying to fight today with this pandemic? And that may be a little one-sided, but you feel where I'm coming from.
Yeah, I do. First of all, I'd like to thank Dr. Rayford for an excellent explanation.
Yes.
It really helped me to understand that. And secondly, I want to comment on the Johnson & Johnson because I spoke to my mother today, and she said that, you think I'll be able to get the Johnson & Johnson? So because of the one shot, it is encouraging a lot of people that I think that would like just to get the one shot deal. And I said, well, Mom, I said, if I had a choice, I said, I'd pick Johnson & Johnson because they said it'll keep you from dying and going to the hospital. So that's good enough for me, you know what I mean? But she said, okay, I would take that instead of having to take the second shot, so that's going to increase the percentage significantly. Back to your question about the Tuskegee Institute experiment.
I didn't call it out, but that's what I meant.
Where black men were used as guinea pigs.
Right.
And that's a sad spot in our history and history of African Americans in this country. And so it brings those things back to mind for those of us who are old enough to know about it and those who studied about Tuskegee. It got a little worse, I think, with this social media thing, though, because I heard people talking about they'll put something in you and they can track you for the rest of your life. I mean, it was just all kinds of BS that was kind of going around.
That's what it is, I guess. It's the truth.
Call it like you see it.
Yeah. But as far as I'm concerned, being a product of the civil rights movement, that the history is there for us to learn from, and we got to learn from the good from our history and the bad. And unfortunately, we've been on the loose end of the bad as African Americans in this country. And if everybody was not getting this shot, if the shot was just designed for black folks, I would be similarly concerned. Mm-hmm. If they say, I got a shot over here for black folks, y'all get in this line, and then the white folks get another line. Right. I'm telling you a fact, I would not get in that line. I wouldn't. But I'm in a line, we all mixed in together, so I don't know how they're going to separate these shots out so well, and give me some bad shots and get white folks some good shots. So I'm comfortable with that.
Awesome. Yeah, and I think from the, training in the medical arena, the medical establishment, but also being a black man, I think it's worth acknowledging that, the American medical system has not been fair and has been outright exploitative to African Americans, and just minorities, not just me and Tuskegee, but during slavery time. So a lot of experimentation on black slave women done by people who were widely celebrated in the fields of obstetrics and gynecology. And now we're kind of reckoning with those terms, reckoning with the cost of that innovation at that time. It was on the backs and the blood and the discomfort. And so it's important, especially with vaccine hesitancy. I think, why a messenger matters or the message matters is, instinct would be to just dismiss it. You have reservations about the vaccine. It's such a good thing. How could you have reservations and really dismiss that history? And I think it's a difference to recognize, hey, there's some historical bad stuff that happened. I understand it. I recognize it. I see that. And acknowledging it and validating people's concerns and those questions. And so, instead of meeting them with, it's not going to hurt you, it's not going to bother you, it's more of, well, let's talk through it. Let's talk through it. Let's acknowledge it. And let's talk about, hey, this is, this was the Tuskegee part. Mm-hmm. The Tuskegee part was men with syphilis and being denied treatment for syphilis. This part is, these are vaccines, the vaccines. So it's a little bit, the context is different from Tuskegee. It was actually denying study participants active treatment that you knew was going to help them. And so, and there's a kind of a fuller debate about the kind of specifics of Tuskegee and how, but what you don't want is, you don't want that to now become, a reason that we're now getting the short end, that there's been some editorials from descendants of men in the Tuskegee, in the Tuskegee kind of experiment, that have kind of wrote editorials of saying, this isn't, this is a little different. Don't use that to kind of, argue against the vaccines as being beneficial. But really acknowledging that hesitancy. And again, I found that, again, I'm focusing on that 85 to 90%. Mm-hmm. I don't know who is on the internet, because one thing with social media is, if you kind of look at a certain type of content, the algorithms in Facebook are going to keep pulling it to you. They're going to keep pulling it to you. And I'm thankful that I didn't click on any vaccine hesitancy websites and all that. Yeah, so I actually get zero vaccine hesitancy kind of things kind of coming up. But if you do, the algorithm for Facebook that, is just trying to, get you to click and stay engaged, will kind of feed you. And that's kind of where, unfortunately, some of the, powerful disinformation can happen, is that enough clicks and the algorithm think you're really interested in it. And then you're thinking that this is the totality of the information about the vaccine. Mm-hmm. And so you've heard about that one person dying about coronavirus 1,000 times, you believe 1,000 people died.
Right. So that is perfect information, and we're gonna ask the people continue to share this. And we're coming to a close, but man, this is good stuff. So I'm finna nudge just a little bit. If you guys don't feel comfortable, push back.
Nudge.
Using the football analogy, just say you're on the 20-yard line, and you ran several plays, and now you're down to the opponent's 20-yard line, and you can see the end zone. And you've said, hey, we got to practice the social, physical distancing. Mm-hmm. We got to wash our hands. We got to wear this mask. We got to do all of these things, and which I'm sure you did that also, Attorney Mayfield. But now we can see a finish line, but we have just been told, that our governor said, hey, we were going to open the state back up. And I know there's a couple of things that are still restricted, but a lot of things like businesses are going to full capacity as of next Wednesday. I just got to ask you, as a physician and as a citizen, whichever one wanted to go first, as a physician or a citizen, how do you feel about this? Do you feel it's too soon, or do you feel that, hey, let's roll with it?
Well, I don't agree with the decision. I think that we are at that point where, you know, we've given out over 600,000 vaccines, you know, maybe 2 million people eligible in Mississippi. We're seeing the new coronavirus variants. And so to have large groups of people with a more contagious and more deadly variant of coronavirus, we're picking up our vaccines, you know. But, you know, I think that I know we can't, you know, I know we're going to get to a point where we're going to have to transition from coronavirus as this new pandemic to coronavirus as the pandemic we, you know, are you know, we know that it's a pandemic, but we're going to have to kind of adjust, you know, as. But I do think that we're close, and you know, my preference would be longer for the mask mandate, get the numbers driven down as low as possible, drive down community spread. You know, we know that when there's high levels of coronavirus in the community, there's high levels of coronavirus in being able to come into the home, being able to get to those people who've done everything that they wanted, that love, you know, so kind of going into, they don't go out, they don't do anything, all they do is interact with their family. If there's a high level of coronavirus in the community, that coronavirus can get to that loved one. And if, you know, it's a whole lot better doing it when the numbers are you know, significantly low. The vaccines haven't exerted their full effect yet, and we still hadn't got enough people, you know, I don't think there's actually a magic number. I just wish there was more time with the masking. And so all that to say is, I guess I've learned over the last year that people don't like to be told what to do, which, you know, that's kind of a reality. People don't like to be told what to do.
500,000 people are dead.
Yeah, 500,000 people are dead. You see examples in other countries where 500,000 people aren't dead. And you know, I think it's history is not going to look favorably on just kind of the totality of our response. And you know, so now is, you know, shifting. You know, I don't agree with the decision. I wish that, you know, we were able to have it, you know, the masking and a little bit more enforcement. More people were able to do it. So there were businesses who were more protective if they had the shield of the mask mandate. Sure, there are people who just weren't going to do it, but there were some business people who, well, this is just the mandate. We just have to do it. So we go back to, all right, don't like to be told what to do, so here's the safest way to not get coronavirus and not have your loved one die from coronavirus is to get a vaccine, to wear a mask, and just wear a mask when you're around people that don't live in your family unit, to distance as much as you can, to try to avoid indoor crowded environments. If you can't wear a mask, try to do things outside. That's the safest. The best way to catch coronavirus is to be in a big group with no mask, poor ventilation, repeatedly.
Attorney Mayfield, how do you feel about the state opening back up at this moment?
Well, I feel like he's yielding to political pressure. In other words, this thing has been about politics, in my opinion. Our former president was pushing the whole idea that it was hoax, it was fake, it was nothing to it, it's nothing but a regular flu. And so many people believe that because a lot of people want to believe it. The governor of the state of Mississippi is a Republican, hardline Republican, a strong supporter of Trump, and that's been part of the problem. I feel like the number of people who have died in this country would be, I don't know the numbers, we have the doctor here, but he might want to throw some numbers, but significantly less had we had proper leadership from above. So it angers me that so many people have lost their lives simply because somebody was up at the top saying it was a hoax. I mean, why would I listen to the scientists and the doctors and say this, y'all all hoax, y'all all, yeah. And so that led us to the position where we are today. So our governor is listening to Texas, Florida, the other states. We need to open it up. The quicker we can open it up, the more popular I'll be among my constituents. I feel like what we need to do is let's get our shots, get our vaccinations. And I have my vaccination. I have both shots now. So I can be a little safer, but I'm still concerned about others. So even when I go to Walmart now, even though I'm fully protected, I put on the mask because that makes everybody else feel comfortable and hopefully encourages somebody else to maybe put the mask on, you know. So I try to wear it out so we can be an example as well. But I really hated to hear him do that, but I'm not in no way surprised.
Gotcha. Well, this has been just an awesome moment here, and I know we're gonna have more to come.
One more.
Yeah,
one
sure.
more.
Yeah.
So I forgot. I'm answering the question you asked me earlier. How to sign up.
There you go.
There you go. So, and we'll have it on Project Elect's website. So there's the State Department of Health, which does the drive-up sites in Lee County at the Barnes Crossing former Sears. So there's a sign up. It's if you're helping people, what you're going to need to know if you're helping people, you're going to need to know their name, first and last name, their date of birth, their mother's maiden name. That's an important piece of information if you're helping people sign up through the State Department of Health. They're going to need a telephone number, an email address, and if you use your own email address, make sure that the printed form gets to the person you're signing up. So for those who can, covidvaccine.umc.edu. There's a telephone number, but the online part is much quicker. Right now, Kroger is offering vaccines. Walmart at Barnes Crossing, Walmart New Albany, Walmart in Corinth, offering vaccines. There are more community places, and I encourage you to check the website. We'll kind of list it on Project Elect about what other community clinics are offering vaccines. And, I tell people whichever appointment, sign up for multiple appointments, whichever one happens first, get it, and then cancel all the rest. The best time to check the State Department of Health website is usually between Monday night and Tuesday, although because there's more vaccine and more options, many people who've had appointments. So today in my clinic, I signed up 2 people on the State Department of Health website for a vaccination 2 days from today. And so there can be some, just as people are getting it other places and signing, so continue to check, and, I encourage those who know how to do the process to help others. So through churches, through communities, through families. Shout out to my wife who signed up 30 plus people so far. And, that kind of effort is going into our numbers being higher and higher. I think people are realizing, hey, let's help people through the process. Just like registering to vote. We know it's not a system that we would design. It's not a system that's ideal, but we learn how to navigate that system and how to navigate it for others. Same thing for vaccines. It's not a system that doesn't present barriers to people who don't live in the city, people who don't have good internet connection, people who don't have a device that can go to that site. But we can help people navigate that system until we get more access, until we can get more community partners access, and so people can get it, with their appointment. People can get it with their nurse practitioner visit.
Now, speaking of nurse practitioner visit, you brought me into this. So we have been wondering, are these COVID conversations we've been having over the past couple of months effective? Through conversation, I know that there's a rural health clinic out in Holcomb, nurse practitioner Amanda Griffin. Through information and through your help and some other people, they were able to now become a vaccine site, and they received their product today. And with that, Dr. Rayford, what's going to happen is that they're already making appointments for some of the elderly that didn't have access, the people that doesn't have their internet, to actually transport them to that clinic because of the information and to actually get them vaccinated. That is so awesome. And I'll say one other thing.
Yeah.
We know that you spoke with the Washington Post today.
The New York Times.
New York Times, okay.
New York Times.
So we're going to get to Washington
Yeah.
Post. And so we know that eventually, I think next week, we'll probably be speaking with the Lester Holt Show, NBC Nightly News. So that's actually coming up too because of these COVID conversations. So I'm just like giving kudos to the people that's been talking about this because it's working. We got people behind the camera. We got Maurice Shumpert, who's the secretary of Project Elect. Kenneth Wheeler have worked with us. Today we have Ray Shoemaker. I guess he slipped out.
He's over there.
Yeah, so he's over there hiding behind the. So all of these people that's been working, other medical doctors that have been on, Dr. Eric Lewis, who's Project Elect, that has led us up to people like Kenneth Mayfield. Man, I'm just excited. You know, this thing is booming, and
It's
we're
powerful.
making a difference.
Yeah, it's powerful. I mean, who would have thought that, you know, when we did our first one at the end of December of 2020,
Yes.
that we will be here. And I think that's the power of, you know, standing out front, encouraging people, being open to ideas, you know, saying, hey, let's talk about it. Let's figure out. And the power of Project Elect of us leveraging, you know, our different connections, saying, I'm not sure how that happens, but let me talk to somebody who's done it before.
Right.
And, you know, I think that's, you know, and I'm proud to be a member, so thankful for membership. And to the audience, to, you know, we have more COVID conversations planned. There's a lot more information to get out. So just be on the lookout, share.
Mm-hmm.
Share this video. If there are questions, add it to the comment section. And, you know, we'll address those questions either in Facebook or at another COVID conversation.
Good point. Attorney Mayfield, any closing remarks? Thank you for just letting us use this building. And I see the sign there, First United Christian Church. So,
Yes, glad
so
to
thank
have
you for
here as
having
our
us.
guest,
And
and,
any closing?
Just like to say to Dr. Rayford, it's just a pleasure having you in our community.
Yes, sir.
And I finally met somebody who can talk more than I can.
So with that being said, we're going to ask you again to share. We're going to be coming back. We're going to have information. Remember, Project Elect, enthusiastic leaders engaging in changing times. And we know that times are changing. And who is Project Elect? We recognize everybody in the community as a leader because everybody has something to offer. You have information, befriend us on our Facebook, direct message us, and we will get back with you. Until next time, this is Robert Hall, and please have a good night.